right, thanks, Paul. Mecklenburg County has a new director of public health. Dr. Kimberly Scott was sworn in early this month. She previously served as the interim health director and as assistant health director of the population health division. Now, as director, she leads a department of nearly 1,000 employees, and we've got Dr. Scott here with us. Thank you so much for joining us this morning.
Thank you for having me. I'm excited to be here.
Absolutely. Wanted to start with this, Dr. Scott. I think we're familiar with your role and what you do because of what we do, but a lot of people out there might not be familiar with what a public health director even does. So tell folks about yourself and what you do.
Certainly. Well, public health is such a vast field, and oftentimes people are unaware of how public health works within their community.
Right.
Our public health department does everything from inspecting local restaurants to make sure that our food is safe, to supporting families throughout their pregnancy journeys with programs like WIC and other care management experiences. We also do things like make healthy choices easy by providing resources to eliminate food insecurity and support chronic disease prevention and management within our community. So our public health department any given day can be responding to illness that impacts our community to supporting environmental health needs of our community. We truly have a job that changes from day to day to support and protect the health of our community.
Wow, that is certainly a big role.
Yeah, covering a lot of things. One of the biggest things people are talking about when it comes to health, back to school season, it's right now upon us. Kids getting all of those vaccines. What's your message to parents about that?
It is back to school season, and we know that there are so many things on the checklist and many oftentimes confusing messages about what we do regarding vaccinations for our youth. I want to stress that vaccine requirements for the state of North Carolina have not changed.
Right.
So it's incredibly important that before school starts that parents access resources that are available to get their children vaccinated. There are critical milestones at kindergarten, 7th grade, and 12th grade, and we have all of those resources available on our website to make sure that parents can make informed decisions and understand what vaccines are required for their children.
And if you are making the regular visits to your pediatrician, like you should be, they should also be helping you stay on top of that, right?
Certainly, certainly.
Awesome. I know cyclosporiasis has been something that we've heard about not only here in our area, but across the country. What have you guys seen in Mecklenburg County with cyclosporiasis, and is it something that we still need to be concerned about?
Sure. Cyclosporiasis, firstly, is not a new disease that's impacted our community. It's something that our public health department has monitored over the years. This year, we have seen an uptick related to an outbreak that's impacted the country. Currently, Mecklenburg County has 48 confirmed cases, including 4 hospitalizations that have impacted our community. The last week, we have not seen any new cases that have impacted our community, but as a public health department, we ensure access to data to ensure the community is aware of what's happening and update our website and our cyclosporiasis dashboard with information on cases that impact our community. It's still important that our community exercise food safety, washing our hands properly, making sure that we wash produce appropriately, cook when we can so that we can avoid or reduce the risk of spreading or expose access to cyclosporiasis.
Very important reminders for folks there.
That or any food-borne illness for sure. Dr. Scott, we've got a lot more to talk about with you, including more back-to-school things that parents need to know about. Of course, with the children's health, we're going to have much more of that coming back on the other side of the break.